Thank you, Senthil sir, for such a nice introduction, I would say, and so much of elaborated introduction, I would say. That's really, you are so humble that you said so much. I don't deserve too much, but definitely I would like to thank you for such a humble introduction and and same times I would like to thanks to the organizer, the Physio Harcon, and every year I have been with the Physio Harcon every year and being associated with that sort of since the Physio Harcon started. And special thanks to Dr. Mudgil for inviting me and a team of HCAP for having such a wonderful uh, e-conference. Right. Today's I'm going to discuss about something about stroke. And as I was watching initial lectures, and I thought that let me not talk using PPT. Rather, let it be a very interactive session with the audience, those who are on Facebook. I can see your comments and I can live answer on those questions. Uh, First, briefly, I'll just elaborate what is stroke is, what is the role of plasticity, how we are training is stroke. So I'll just briefly I'll go through my slides, and later on for 5-7 minutes we'll have a discussion session so that the maximum people can get benefited with this session, and this is what the objective of this session is. So let me just go through the slides quickly to make you understand what the stroke is all about. All right. So here is, we are going live. You can just type yes or no when you are able to see my screen. Right. So stroke rehabilitation, some updates I'm going to discuss today. What is stroke? As you can see on your screen, you can see that stroke causes an abnormalities, and what these abnormalities are, it causes a function loss. These abnormalities of movement, which is restricted, or you may say that it is the abnormal movements which is being impaired movement due to stroke, is because of stroke is causing the functional loss. So let us understand what is the actually function is. So the function is result of a series of movements. It is not an individual movement. As you can see on your screen, that there's a girl who is that girl is objectively just trying to jump and hurdle, and you can see that from the first picture, when she's starting and when she's ending up just crossing the hurdle, you can just note down that there are lot of movements taking place at the hip, at the level of ankle, at knee, at hip, at even in trunk, and even in upper limb, which is not at all uh, associated with some jumping function, right? So now we have to understand that the function is series or sequence of movements. Okay, so now let us understand how normal movement execution takes place and what it is required. So now we understand that there is a biomechanical sequencing which are very important to have for a normal movement executions. There has to be an optimal soft tissue interaction, because there are a lot of movements taking place. When there is a soft tissue integrity is not maintained, that those movement could not be executed in the way it has to be, right? So that is the optimal soft tissue interaction. And the third is, even if you have a very good sequencing, even if you have a very good soft tissue interaction, and if you don't have a motor programming, motor control, then definitely that movement is not going to execute it in the way it has to be, so that it will be an impaired movement, and it will not be in that sequence. Let's have another example. One sequence follows and a next overlap. Like human is not robot. It has to be and a very precise and a very accurate step by step or overlapping sequence of movements, so that it takes a proper efficient movement, what we can say, right? So here you can see, just having an example of sit to stand, there are different sequences and there are different steps in sit to stand function. Sit to stand is a human function. Every day we do, and this sit to stand function is requires some sort of sequence of movement, like flexion momentum takes place, then this momentum get transferred, and then there is an extension of trunk and a hip, and then the stabilization phase comes. So the first thing, if you look at here in the first here in this picture, you can see that the person is sitting here. This person is sitting here, and this in this picture you can see here, the person is transferring his momentum to get a stand, and here the stabilization is taking place, you can see at this point of time, right? So moving ahead, here, if in this picture, if you can see, do you see that the same movement is taking place here? Here there is something going wrong here, that the momentum is not getting transferred, the stabilization is not good. Okay, so this is where this is this the impairment is. So now you may have a fair idea that this a function required very in a series and sequence of movements, and that's a series to happen in a way it has to be required in a very good motor programming. It requires in a soft tissue interaction. It requires a good biomechanical sequencing, right? But the problem is, when we talk about stroke, what comes in mind, our mind, the first is that how we look at stroke basically is that it is a problem which affect the brain and nervous system. Yes, of course, it is very right that stroke causes something damage to your brain, and it is called as a brain stroke. It causes, but that is the central component. We are always talking about the central component, but actually the problem lies more than that. Okay, there are muscle, there are fascia, there is a soft tissue, and the peripheral component. Sometimes we forget about those peripheral component, because see, one is stroke patients, if somebody is immobilized for even for an 48 hours, the research have shown that the muscle atrophy and changes at sarcomere label start at that as early, right? So we have to take it in mind when we are dealing with the stroke, not only stroke particularly, but in any neurological patients, if we are dealing with, we need to think about the central component as well as the peripheral component, because already there is an impairment in motor control, and in somebody has poor motor control, if we don't have the good soft tissue integrity, then definitely the movement will not be executed in the way the normal movement has to be. In sports person, those who have no even in no impairment, neurological impairment, but if their soft tissue integrity and other things are not intact, their motor behavior, their motor control, their normal movement get disturbed, and the sequencing get disturbed. So keep it in mind, then when there is a poor motor control, definitely it is going to play a major role in executing in a normal movements. Okay, so what the core, what the take home here is that we need to, whenever we deal with any neurological impairment, you must have seen that the most of orthopedic and musculoskeletal approach are also now taking care of these uh, central component, that movement execution, that movement component, the musculoskeletal the function is also connected with your central component, brain and nervous system. Similarly, any neurological impairment will also have the impact of peripheral component like muscle and fascia, and those peripheral component will play. So what is take home here is that central as well as peripheral component of both of components are important. It is not necessary while dealing with the neurological patients, it is not necessary that we need to focus only on motor control, but definitely we need to focus on peripheral component also, right? So there are biomechanical component like we always say that human body is one, all the systems are interconnected, and one body section segment can affect other body section segment. Like for example, you must have heard about your ankle can affect your back can affect your position of tibia, your ankle position can affect your tibial rotation and all that. So the biomechanical components, yes, so one body component uh, influence other body segments. That this is also we need to keep it in mind when we'll be dealing with not only the musculoskeletal dysfunctions but also the neurological dysfunctions. Like in the third picture, if you see here that this is the motor component part we are discussing here, that the peripheral demand influence central programming. Yes, that's true. You just have an example that if you hold some balloon or something kind of very light object in your hand, and the amount of your tone in your biceps is required, will it be the same if you hold something very heavy object in your hand? No, obviously not. That if you hold a soft and a very lightweighted object in your hand and you know hardware, so the tone generated by your central cortex, your brain, your cerebral cortex is different. How it is different? Yes, there are some feed follow mechanism from your mechanoreceptors, your Golgi tendon in muscles. Those are giving feedback to your brain to act upon. So this is what the principle here is, that peripheral demand, how demand we are putting on periphery will definitely modify your central programming in your brain. And the next thing is the central programming influence peripheral movements. Yes, how well programmed your brain is and how it is good, accurate programming here is influencing your central and your peripheral movement. Like this girl, a gymnast, just have an example of this girl who is a very narrow base of support. She's standing and she has so much of accurate control in her eccentric and constant contraction of activity of the muscles, agonist and antagonist. So there is so much of accurate control by motor programming that she is able to maintain her balance, and her reaction time is so good that she is able to maintain. But when we do such activity, our accretion time and programming time, just result of programming of motor compound, it will not be so accurate. The soon with our the base of support fall outside, it is going out of control and we get fall, right? But here she has so much of control that soon the center of gravity fall or deviate here and there from base of support, and her muscles act concentrically and eccentrically, that she just pulls back the base of support, the center of gravity in between the base of support. So this is how she is able to maintain that. So remember always these four principles while you are taking care of any neurological impairment, not only stroke, that human body is one segment can affect other one body segment influence other segments. So sometimes you train the shoulder, you do it intervention for shoulder, but you may find some improvement in hand also. Peripheral demands influence the central programming. So how demand we are going to put on periphery, that is going to reprogram your brain, and the center programming influence the peripheral movements. So all these principles we have to keep it in mind at whenever we are dealing with some neurological patients. Okay, so there are a lot of research. You just, if you go and just find out that there are a lot of research you can find, and about these all what principles I was talking about, that how the brain is reacting with musculoskeletal system, and how musculoskeletal system is influenced by other things, and how like spasticity is developing some tightness in muscle, how it is going to like for example, see any CNS injury comes, and then there is some sort of paresis. Yes, obviously there'll be some weakness here. Then after the weakness, there'll be some increased centrometrics viscosity, and because paralysis there is a no intermuscular activity, and at the molecular level, at the sarcomere level, there'll be some intracellular extracellular matrix changes will take place. Then there'll be active muscle contraction, tightness, I would say, rather tightness here, and that tightness somehow it goes to overall the cycle, and ultimately it comes like a totally the soft tissue integrity is not intact. The postural adaptation, and the aggravation of spasticity, there'll be passive tightness, stiffness, and definitely there may be some of fibrosis or decrease, and that then definitely it is going to affect overall functionality of your musculoskeletal system. And now imagine that where there is a poor motor control, and same times there is a poor soft tissue integrity, then definitely it is going to make you the patient is going to suffer with lot of this movement. Like for example, these are the elaborated one, the peripheral demand influence center programming. Another example here in this there's a publication, Journal of Neurophysiology. Here you can see how brain react with your demand. Like for example, here you can see that the person has given an objective to touch this, and we have blocked the hip here in this picture. So when the person has no restriction push button, this is normal biomechanical function, that when we bend forward, your pelvis goes back, and just to keep your balance intact. So this is what the your center of gravity here, it is falling here down. When you bend, your pelvis goes back here, so your center of gravity will fall backward. This is why the person bent, and the center of gravity shift here somewhere, right? So it fall within. So this is what the normal physiology. But when you block the hip here, the person may not go back, so he will have tendency to get fall. So what brain does, brain modify that same movement, and the person takes an stance and touch the objects. So this is how the brain react with the peripheral demand, how things are put on the demand. Same way this is also, and this is what I was talking about, the change in muscle architect in a stroke takes within 48 hours, and that's all core of I have already taken lecture on is neuroplasticity. You can just go ahead in the Haryana HCAP page, you will find a detailed lecture on neuroplasticity. And this is what is the core, like axonal sprouting, is synaptic strengthening, activation of weak pathway influence the recovery of stroke functionality and the functional regain. Basically, neuroplasticity is a flexible property of brain to temporarily change and take structural changes in your brain. So you just watch this small video. You will understand how this spasticity,
different experiences create different neural connections which bring about different emotions. And depending on which neurons get stimulated, certain connections become stronger and more efficient, while others may become weaker. This is what's called neuroplasticity.
Right. So this was just to make you understand better in a better way. Definitely, it is as simple as that. Every day you go to your office, your clinic, your hospital, from taken away how you road, how you reach your office. It is similarly there is a pattern in your brain. Since our birth, we develop that any moment, like I'm holding an object or I'm doing something. The brain, the information travels through the neurons. It takes a specific path, but when that part, that matter, white matter, gray matter, get damaged, what you do, it is as simple as to understand that if there is a road closed, if there is a crisis that you can't reach, can't go with that road, what you do, you try to find out another way to reach to your office, you reach to your um, uh, clinic, your hospital, or everywhere, wherever you want to go. Maybe it is in a shorter way, maybe it is a longer way. Same thing happen when you start training your brain. When you put in a demand on brain, a brain try to find out the way how I can execute this, and this is what is the way how we should neuroplasticity function. And we have to have understand there are a lot of principles behind that. We need to adopt those principles, and we need to function on that basis on that, to just have an activity dependent axonal or sprouting synaptic connections, or strengthening a weak pathway, or which was already in existence, but the brain was not using that. So we need to strengthen those pathway to make the patient or person who is suffering with the stroke to make a good recovery. So there are few video here. I'll just just for you to understand, make you understand that you can just have a first video here. This first video, you can just see this is the typical presentation of a stroke patient, where you can see that there is a no hand right. So a stroke, this is very common problem in a stroke, we must say. And you can just see that something went wrong. Wait, just hold on. Okay, so you can see just uh, the first video. You can find out here that there is no movement, and the second video you can just find out the pre and post videos, how the person, if you target in a way that can really make a difference in the patient's population, right? Okay, so this is all about this presentation, and I'm open to question. If somebody has any question, we can just have a live questions here, so we can answer. I can see your questions. You can keep typing your question in Facebook comments, and I can answer those. Good afternoon. So if anybody has any questions, and they can put it in comment box and I can answer. So there is no question. I think uh, the people have understood the core. We cannot explain everything, but definitely they have some idea about what the stroke is and how we can take care of a stroke. Uh, what do you think of when you are dealing with the neurological impairment? It is not always that when you are suffering with the stroke, it is not always that the only neurological component we need to take care, like a central component, but definitely we need to take care of the peripheral component, which includes the all musculoskeletal component, muscle fascia, and other components. So the good movement pattern can be developed, and it is easier for making the execution of motor behavior. So these are very important things, right? So I believe there is no question. So can we wind up this session? I'm trying to find out if any comments or questions on Facebook. Trying to. If somebody can help me out by to just type it for me, if any questions there. Yes, I think there is a question. Abacus techniques using in children is helping the stroke patients. That's a cognitive therapy, and there is no evidence that we can use it here, but definitely it can add on their memory function, and their cognitive function can be definitely improved. There is a question that stroke patients for spasticity management. See, spasticity is itself a great topic to discuss with, but at this platform I can just say that much, that spasticity is there are different components. Spasticity is not only central, and here also there is a problem with, there are some architectural changes also takes place at periphery, and that definitely add on to spastic behavior of muscle. So definitely we need to have an elaborate knowledge of spasticity management while dealing with stroke patients. Your point on mechanism, how neural things. I think it's gone on. Just hold on. So it is then definitely the Senthil sir, great question. The neural mobilization will help spasticity, sir. Definitely. See, I was talking about the peripheral component, and definitely you are the master of that. You can elaborate much, but in my view, as you asked, that definitely it will help to have the irritation of nerve to ease on, and as because the muscles are really in a pathetic state and immobilized state, or maybe in a very tight state, so definitely get giving some neural mobilization and easing those nerves will definitely change the behavior of nerve, how it is going. And rest you can really elaborate sometimes if but as my point, definitely it is going to help in relieving some of spastic behavior of muscle. Right. So there is no questions furthermore coming. So just over to organizer, and I'm going offline. And thank you so much. You can jot on your queries later on this page also, and I'll try to have a look on the page so that I can answer your query. Thank you so much for being with us today, and thank you so much HCAP for inviting me and giving us such a platform to discuss and share my knowledge. And thanks to all the participants, including and particularly the senior people, Senthil sir, Lamba sir, and everyone is there. So thank you so much, sir, all you all here, and for giving me and watching me. Thank you so much.